Hi, my name is Lauren and I'll be your occupational therapist. How are you today?
I'm doing well.
Good. So today we'll be testing your cranial nerves. So what the cranial nerves are 12 nerves in your brain that have motor and sensory functions in our head, our face, our neck, and our shoulders. So we're testing these nerves today just to see if there are any neurological changes to these nerves, because if there are any changes, then that could cause motor or sensory difficulties that could affect your ability to engage in your occupations, which we don't want that to happen. So that's why we're testing them today. So today the test will take about 10 minutes to complete, and it'll involve me getting close to your eyes, nose, and mouth. Is that okay?
Yes.
Okay. So for the first test, we'll be testing cranial nerve 1, which is your olfactory nerve, which controls your sense of smell. So first I have to ask, have you had any changes to your sense of smell lately?
No.
Perfect. Okay, so for this test, it'll involve you differentiating between two scents, and I'll have you close your eyes, plug one nostril, and then smell a scent, and then tell me what it is on that. Okay, are you ready?
Yes.
Okay, close your eyes for me, plug one nostril, okay, and then smell for me.
Christmas tree?
Yes, perfect. Then I'll have you switch, and then sniff.
Cinnamon.
Perfect. Okay, olfactory nerve is intact. Okay, so next we'll be testing your pupils to see if they're equal, round, responsive to light, and they accommodate to changes in light. This one will involve me shining a light in each of your eyes. Is that okay?
Yes.
Okay. So I'll start with your right eye first. Right eye looks good. Left eye looks good. Okay, and then I will shoot your eyes to make sure that they get bigger. Perfect. Your pupils were round, equal, responsive to light, and they accommodated, which is exactly what I was looking for. Next, we'll be testing optic nerve 2, which is your cranial nerve 2, which is your optic nerve, which controls visual acuity. Have you had any changes to your vision lately?
No.
Do you wear eyeglasses, contacts, or are legally blind?
No.
Okay. So first test, I'll have you look over at that poster for me and tell me 5 words.
Trust, figures, focus, climb, treat.
Perfect. Okay, and then next test, I'll be testing your visual fields of each of your eyes. So I'll have you keep your head straight, eyes on my pen. Keep your eyes forward, focus on my pen. So first I'll ask you, what color is my pen?
Blue.
Perfect. Okay, and then I'll be moving my pen into the different quadrants of your vision, so on either side. Then I'll have you tell me when you're able to see it. Ready? Here we go.
Yes. 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 Yes.
Perfect. Okay, that nerve looks good. So next we'll be testing cranial nerve 3, which is your ocular motor nerve, which controls eye movements and pupil dilation, as well as the elevation of your eyelids. Cranial nerve 4, which is your trochlear nerve, which controls vertical eye movement, so up and down. And then cranial nerve 6, which is your abducens nerve, which controls horizontal or side-to-side movements of your eye. So for this one, with my pen, I'll have you keep your head straight, eyes focused on my pen looking forward, and then I'll have you follow my pen with your eyes only, not with your head. Okay, you ready? Here we go. Very good. These nerves look good. Okay. Next, we'll be testing cranial nerve 5, which is your trigeminal nerve, which controls facial sensation, facial expression, as well as the chewing, so the muscles in your jaw. So first I have to ask, have you had any changes in the sensation in your face? Like, is one side more or less sensitive than the other, or are they pretty equal?
They're pretty equal.
Okay, very good. So for this test, I'll be touching areas on your face with either a cotton ball for soft, or a sharp with the back of a bobby pin.
Yeah.
Okay, and then with this test, I'll have you close your eyes, and then I'll have you tell me what you're feeling. You ready?
Yes.
Here we go.
Sharp.
Okay. Soft. Okay.
Sharp. Sharp. Soft. Sharp.
Perfect. Okay, eyes open. Okay, next I'll be testing the muscles in your jaw. So first I'll have you clench your jaw really tight. And then I'll palpate. Nice and strong. Okay, then I'll have you open your mouth wide. Then I'll have you resist against my pressure to push it to close it. Very good. Okay. Next, we'll be testing cranial nerve 7, which is your facial nerve, which controls facial expression and taste. So for this one, I'll have you do 4 movements. So the first movement, I'll have you wrinkle your forehead by looking up with your eyes. Perfect. Then I'll have you smile really big. Have you frown really big. Have you shut your eyes really tight. Then I'll have you puff out your cheeks. Beautiful. That nerve looks good. Next, we'll be checking cranial nerve 8, which is your vestibulocochlear nerve, which controls hearing and balance. So for this one, I have to ask, have you had any changes to your hearing?
No.
Perfect. Okay, can you hear me speak?
Yes.
Okay. So next, I'll have you plug one of your ears, and then I'll say a phrase or word into your other ear, and then I'll have you repeat it out loud. Are you ready? Okay.
5.
Perfect. Switch.
8.
Yes. Perfect. Okay. Next, I'll have you do the balance portrait. So I'll have you stand up for me. Okay. I'll have you put feet together, and then I'll have you cross your arms over your chest, and have you close your eyes, hold your balance. Good. And then I'll have you switch your feet to one in front of the other, arms crossed, eyes closed, hold your balance. Beautiful. Okay, eyes open, and then I'll have you spin one direction, spin in the other direction. Very good. And I'll have you walk forward, then walk backward. Very good. Pass. Very good. Balance and hearing looking good. Okay. Next, we'll be testing cranial nerves 9 and 10. So cranial nerve 9 is glossopharyngeal, which controls taste and swallowing. And then cranial nerve 10, which is your vagus nerve, which controls swallowing, your vocal cords, and throat sensation. So first I have to ask, have you had any changes in your voice quality?
No.
Perfect. Okay, so for this one, it'll involve me shining a light into your mouth with your mouth open, and I'll have you say "ah" for me to see, and I'll check to see if your uvula is in midline and your soft palate elevates. You ready?
Yes.
Okay, so open wide for me. Say "ah." Beautiful. Your uvula was in midline and your soft palate elevated, just exactly like I wanted, or it was expected to. And then the next one we're going to test is your accessory nerve, which controls head and shoulder movements. So for this one, I'll first have you turn your head to the right, so I can palpate the muscle in your neck. Nice and strong. Okay, then I'll have you turn the head other way. Test that one. Okay, I'll have you look forward. Test your triceps. Nice and equal. Okay, so first I'll have you shrug your shoulders up high, and then I'll have you resist against the pressure. 1, 2, 3. Relax. Okay, then I'll have you put one ear to your shoulder. Then I'll have you resist against the pressure again. 2, 3, relax. And then I'll have you switch. 1, 2, 3, relax. Okay, and then I'll have you turn your head again to one side. I'll have you relax, and then I'll have you resist. 1, 2, 3. 1, 2, 3, relax. Okay, then I'll have you do it the other way. 1, 2, 3, relax. Okay, accessory nerve looks good. Okay, so for the final nerve, the 12th cranial nerve, which is your hypoglossal nerve, which controls tongue movements, I'll have you stick your tongue out straight. Very good. And I'll have you go do quick left to right movements with your tongue. Very nice. Okay, for the final test, I'll have you repeat a phrase. The phrase is, the quick brown fox jumped over the lazy dog.
The quick brown fox jumped over the lazy dog.
Perfect. Your hypoglossal nerve was intact. Thank you for being here. Okay.
So if my client was to have dysfunction in one of your cranial nerves, for example, if it was cranial nerve 11, which is her accessory nerve, my client would have limitations in her ability to engage in her different occupations due to the limitations of the muscles that the accessory nerve controls, which are muscles of the head and shoulders. Biologically, the muscles of the neck and shoulder allows the client to tilt her head, turn her head, raise her arms over 90 degrees of flexion, and flex her neck to side, or forward and backward, or forward actually. She would also experience pain and scapular winging, and there may also be instability of the shoulder girdle. With dysfunction of cranial nerve 11, the accessory nerve, she would not be able to perform her ADLs, such as brushing her hair, showering, upper body dressing. It may cause difficulties in her sleeping, and she may also experience difficulties in performing IADLs, such as driving, which would affect her opportunity to move around her community It may also affect her ability to go to work and perform her work tasks as an optician, and engage in social participation with friends and family. In terms of psychological effects of dysfunction in cranial nerve 11, my client may experience depression due to her inability to perform ADLs and IADLs independently, as well as go to work and perform her work duties. And there may also be experience of anxiety from the pain that she may experience from the weakness in her sternocleidomastoid or her trapezius muscles. And the anxiety would prevent her from wanting to engage in occupations, leave her house, because she would be in too much pain to be able to do anything for fun or independently. Socially, the client would not be able to participate in family events where she would want to spend time and play with her nieces and nephews, which is a very important occupation for her as an aunt. She would not be able to carry or hold her nieces or nephews to play with them or put them to sleep due to the weakness in her trapezius and the inability of her to flex her neck due to the instability or dysfunction of her accessory nerve. Thank you.